Peace be to you all. Assalamualaikum. Omar here, physician associate, health educator, and middle-aged endurance runner. So, just finished here at the doctor's office. It's a very busy 8 hours. So I have a student that I'm mentoring. She asked me a very interesting question before she left, and that question was, what was my biggest challenge as a new graduate? So I had to think back about 22 years ago, and I wanted to answer her as accurately as possible. So I remember my biggest challenge, I think, was just acclimating to being a professional clinician. So in PA school, it's markedly different than medical school. In medical school, even after your 4 years of medical school, you still have 3 to 7 years of residency, depending on your specialty. Let's say you're doing something like I do, which is basically internal medicine as a PA. Well, the internal medicine rotation, or residency rather, for a doctor is 3 years after medical school. And it's after taking your USMLEs, step 1, 2, and 3 through your medical school training in your first year of residency. And then you got to sit for your internal medicine boards, and then maybe you do a fellowship or two. That's still another 2 years. So there's a vast amount of training to become that attending physician. And then even with doctors and nurse practitioner, they actually have to work as nurses for years before becoming NPs or DNPs now. We PAs, after 4 years of undergraduate in biology or whatever you got your bachelor's in, do a 2-year master's degree program, and then you pass your PANCE, your Physician Assistant National Certification exam, and get hired. Then you're this prescription writing clinician. And I think that's one of the important reasons why we need to have physician supervisors, because our training is really truncated when compared to physicians. We're competent, but as PAs. So as a new graduate, a new PA graduate, you've really got to slow your roll, because if you are functioning in the capacity of maybe the one of 2 healthcare providers, for, let's say you're out in a rural clinic somewhere way out in the boondocks, or like me in an inner city doctor's office, you may be the only provider that the patient may see at a particular time, provided that the physician, your supervising physician, has built up a level of trust in your abilities and can leave you by yourself. So you take the training wheels off, as it were, and he says, okay, you see these patients, call me if anything goes awry, or of course send them to the emergency room if anything goes awry. But that for me was a great challenge in the beginning, because I had to think, like, okay, number one, I need to get these supervising physicians confidence in me. So I need to kind of show them what I know. I had a very steep learning curve. I was doing a lot of infectious disease in the beginning. So there was things like HIV medications, and keep in mind this was more than 20 years ago when we had heart therapy. So high antiretroviral therapy. I forgot the other A. Or high antiretroviral therapy. I forgot the other A stands for. But people are on, they're taking 40 pills a day, dealing with side effects and everything. And oftentimes as a clinician, you're on the receiving end of somebody's ire about, the side effects and things that they're getting and how they're not going to take the medications. And here you are, a brand new clinician, wet behind the ears, trying to develop a bedside manner and convince this patient that you actually know what the heck you're doing. And maybe they've had this doctor who's been following them for years, or they have a new diagnosis. And they don't want to see you. They want to see, the real doctor, not the fake doctor. So you have to tell them, like, okay, I want to respect that. So you can't internalize that. That's number one. When patients yell at you and tell you that they don't want to see you, they want to see the doctor, they don't want to see the PA, and that's their right. When you get older like me, you don't care. Like, hey, good, fine, let me in. You can see the doctor when they come in or reschedule your appointment, and that's you still get paid the same, and it's not a slight on who you are or what you've accomplished. So you learn not to internalize that and let that shake your confidence. But it may take a while. But as a new clinician, it may really shake your faith in your own abilities and maybe even in your decision to become a PA. So that's one thing you may have to get over. Maybe the second thing also is, or maybe the third thing after the steep learning curve is really slowing your roll and understanding that you're not the doctor. You are not. You didn't do medical school in the residency. Even if you did, what some call a residency for PAs, it's not a doctor's residency. It's an extra training after PA school. So you have to really slow your roll and understand your function, your unique function on the healthcare team. As the PA, when I finished school, we were called physician assistants. And even those that came before me were physicians apostrophe assistants, and now it's physician associate. When you first come on the scene as a new PA, you're going to have to take a lot of things into consideration. So the learning curve, mentally, with the lack of knowledge that you have about the particular field in which you work, even though you learned a lot of cool stuff in PA school, and you did well enough to pass your pants, enough to pass your pants, there's still a very steep learning curve, and that's something that I had to overcome. And then even developing things like bedside manner, even though I was as an outpatient, be a good listener, be able to take, you got to really be tough, mentally and spiritually. You got to be able to take a lot of the patient's kind of angst, and that was a challenge for me. I wasn't used to being yelled at by patients, even though I've been a nursing assistant for many years. There's a different degree of yelling that they do, no pun intended. But between, from being a physician assistant where you're emptying bedpans and wiping them off, to now you're diagnosing them and, coming up with their treatment regimen, writing their prescriptions, there's a higher degree of responsibility and accountability that you have to accept as a new clinician. And that also was one of my challenges. But I acclimated fairly quickly. And then I'd say another challenge was, this is a good challenge, getting used to my pay. So I went from being a $7 an hour nursing assistant, and then an $11 an hour biotechnologist after I got my biology degree, to then earning a whopping $56,000 as a PA. That's what PAs were making, a little more than 20 years ago. And then I was an adjunct faculty member for $24,000. So I was making $80,000 a year, which back in 2021 was like, that was a ton of money for a PA to be making. So I got to do some fun stuff with my wife and our newborn child, who's now a 22-year-old man. But you got to know how to manage your money, that new money that you get. So for those of you folks that are coming out and you're going to be making that big PA money, which isn't so big anymore because it's $120,000 a year now, is, even though it's more than the average income, it's less in a way because college education is so much more expensive and the cost of living is more expensive. But back then, that was a nice challenge for me to have. But I hope that answered some of you guys' questions about biggest challenges as a new PA grad. If you're interested in becoming a PA, you can feel free to reach out to me. I'll put my contact information in the description. I wish you guys all the best of success in your positive endeavors. Peace.